Okay, here we go. Recording is started. Hello, everyone. Hi, welcome. My name is Stacy Nell. I'm the Executive Director of the Kansas African American Affairs Commission. And this is our Lunch and Learn. It's pre-recorded. I love doing these things pre-recorded now. I've decided I may never go live again. Too many things go wrong when you go live. And I am thrilled today to be joined by Nicole Garner. Hi, Nicole.
Hello, Stacy. I'm so happy to be here. Good afternoon.
Now we have to have our whole conversation over again because we were talking before we put, and I'm like, wait, stop talking to me. We have to push record. Yeah. Nicole, let me just give a brief background to people who may not know who Nicole is. Nicole Garner is the director of the newly formed Center for African American Health with KU Med Center in Wyandotte County. Okay, she has a background in healthcare leadership with both profit and nonprofit organizations, driven by a passion for building up underserved communities. After a successful journey in long-term care industry, Nicole has made a profound decision to embark on a new path led by purpose and passion, a journey into the realm of public health, driven by her innate desire to make a meaningful impact on underserved communities. Most recently, she was working with the Wyandotte County Health Department as a COVID project manager and a planning operations division manager during the COVID-19 pandemic, which is where we first came to know each other. And I know that your official start date was of being the director of the Center of African American Health. It was June 17th or something like that.
July 17th.
Close. July 17th. Yes. I know it was July 17th because I was emailing going, when is she starting? And they said July 17th. And I said, okay, I should probably not talk to her, let her find the bathroom and things like that before I get her on the show.
I appreciate it, but I'm so happy to be here.
But now you've been here almost a month. I'm so I want her on the show now.
Yes, and I'm here and happy.
Good. All right. So the first question I always ask people, what are you having for lunch? Or what did you have for lunch? What's going on?
So for lunch, I had some leftover pasta with salmon bites and shrimp and spinach. So yeah, so just leftovers. So I warmed that up, and then of course I have my water that I'm trying to drink all the time because we know water is good for you, but I have to constantly remind myself. So I have my 40 ounces of water that I hope to drink throughout the day and get my water in.
Force it down. I know. I drink a lot of water when I drive. I don't know. I drink a lot of water when I drive, but if I'm just sitting here, sometimes I'll forget. Well, good. I actually went out to lunch and had a teriyaki chicken wrap and had half of it and some tater tots. And so I'm like, I got lunch for tomorrow now.
Yeah, that sounds good.
I don't often eat, fancy. Okay. But enough about what we have for lunch. Yeah. Okay. I have brought you on because you are the director of the Center for African American Health at KU Med. Now, this is new. Mm-hmm. And I want to talk about how this even came about. Can you give us the background?
Absolutely.
When I heard it was happening, I was like, KU's doing what? Say who now how? So how did it even come about?
Well, so how it came about, this conversation, so it really was the vision and dream of Dr. Geraldine McGee, who I have to give credit to, and she was able to put a team together. So she had been thinking about this for quite some time, many years, but the conversation started to really form and come together about 2.5 years ago, led by Dr. Geraldine McGee. And others, our pillar directors who are going to be over our 4 areas of focus that I'll kind of mention here a little later. But they came together along with community and really found out that there was a need. And this all kind of came about after or during COVID. Mm-hmm. Bringing a meeting of the minds. And so working with, the team at Kansas Medical Center, in addition to led by Dr. Geraldine McGee, members of the community, members of the church community came together and started to just really form and conceptualize a Center of African American Health that will live in Kansas City, Kansas. And then we would also have an office or have a center in in Wichita, Kansas, because we want to make sure that we are reaching everyone in the entire state of Kansas. And so the mission was to really partner with community and to enhance the overall health and wellness of Black and African Americans living in Kansas and beyond. And so those 4 pillars that I just mentioned is service, education, research, and policy. And I am honored to have or be working with some brilliant researchers who will help lead those different pillars. And so Dr. Jill Heffler will focus on service. We have Dr. Jason Glenn, who is focused on education. We have Dr. Michelle Redmond, who is focused on research, and then Dr. Charlotte Smith focuses on policy. And we have initiatives around each of those pillars that we want to bring forth as we grow out the center and eventually have our own brick and mortar building, which will be partnered with Vibrant Health when they open their new building or new facility, slated in June of 2025, that we're really, really excited about.
Okay, so right now you don't have your own separate building. You're just all housed at.
We're just, so I'm on the KU campus. So really, we don't have our own building, but that is the plan, is to be in our own building sometime in the summer of 2025.
Okay, so having an idea is one thing. Even getting a bunch of people together to talk about an idea is something else.
Right.
How does it get from that to approaching KU Med Center and getting their buy-in to say, yes, we're going to do this?
Absolutely. Great question. Well, first, I think the first approach was just really understanding what proportion of Black and African Americans need primary care, understanding the voice and what the community wanted. I think so many times people have great ideas that directly impact or are created as a result of the negative impact, the disproportionate amounts of care and the systemic issues that take place within our community, but we don't really engage with community. And so a lot of how we sort of came to this was really getting buy-in from the community, doing listening sessions, prioritizing and looking at all the research that has taken place from our community health assessments to our CHIP. So taking all the information and all the disparities and barriers and structural racism and institutional racism that exist within Kansas, specifically within Wyandotte County and Sedgwick County, taking all of that information and really mapping out what a Center of African American Health, how the impact that it can have on the community as a whole. And so asking ourselves additionally, who is not at the table that needs to be at the table to make this a reality? And like I mentioned, with the vision of our pillar directors, Dr. Geraldine McGee, and partnering as the Vice Chancellor of Diversity, Equity, Inclusion, that team was able to come together and really impress upon KU to make this happen, in addition to the community.
Wow, I'm sorry, I'm just going to be eternally impressed. Okay. So let's talk about the pillars then. The 4 pillars, and you mentioned them: service, education, research, and policy. So, like, what's the service pillar about?
Wow. So the service pillar is primarily focused on how we can provide direct services to Wyandotte County and Sedgwick County residents and beyond. So in the entire state of Kansas. So just to give you an example, when we think about navigating through the healthcare system, and especially when it comes to Black and African Americans, there's so many things, and we probably all have a story about not getting quality care, not being believed, or being sent away, just experiencing plain on, implicit bias and racism. And so as the service pillar, we really want to work and vet, other healthcare organizations and work with them to look at how they engage with Black and African Americans. If someone were to come and say, I'm having a challenge, or I was diagnosed with cancers, let's say, but I haven't gotten the treatment or the service or the answer that I need, they can come to the center, and the service sort of pillar would help them navigate through those systems. Also acting as a referral source. And so although we won't be providing necessarily direct care, we'll be partnering with other agencies or organizations to refer and help with that care. Because we don't want to be in direct competition, but what we want to do is look at who is doing the work well and partner with them.
So if someone had a question, even if it's not a complaint, if someone said, I'm trying to find, would it be appropriate, give me a sentence out, would it be appropriate use of the center? Like if someone was like, I'm trying to find a Black dentist or I'm trying to find a Black OBGYN, can you direct me in that direction? Or is that also like, for example, like you said, if I've got this diagnosis, would they come to you to say, where can I go to get a second opinion? Or like, how does, since you don't actually provide direct care, is that it's more of a
It's so yes to those questions. We will have, in fact, we will, and let me back up. We plan to have, community health workers. We will employ a social worker and have some clinical expertise. So although it won't be direct care, we will have licensed clinical staff that will help and be an advocate and help people navigate through the health systems, and there's many, in addition to being able to refer for people to receive the direct care. So yes, without those questions, yes.
Is there any plan to maybe do education for the doctors on implicit bias or on the medical?
That's actually a part up under our education pillar.
Okay.
We have Dr. Jason Glenn is leading up that work. And we're focusing on the repair project, and the repair project is really to help, I want to say, shake up the learning institution, or to really help directly, work with learners and teaching them about implicit bias. We're going to do a dashboard that will really help correlate all of the clinical care to make sure that physicians and learners, and I'm saying learners because there are a lot of learners within the KU system, to really, remove any of those barriers and to help teach how to deal specifically with Black and African Americans and understand.
Okay, so here I wasn't catching on to that. So the focus would be on the students who are going through KU Med.
The students, beautiful. And when I say yes, the students, so medical students, but I say learners because that also includes administrative staff. That also includes nurses. So we're really using that term learners because anyone who touches or has touch points with patients directly or indirectly, we understand that they also need that education or training. So we don't want to just limit it to physicians or future physicians, but we really want to say learners, anyone who is in the KU system. And we want to build that trust, increase the presence in the community. So all the things that we are wanting to do at the Center of African American Health, the Repair Project is really going to get into our internal best practices to ensure that the barriers and the structural racism that exists within the medical system, we can remove those, and we're really bringing up, well-rounded, medical professionals.
Wow, that's fantastic. Okay, so that's education. Then you've got a research component.
We have a research component, and I'm really excited. This is kind of breaking news, but not really. One of our projects that we're going to focus on, and you may know about this because of the work that you do in Wichita, there was an oil spill that took place back in, they first found out about it in 1999, Union Pacific.
The train derailment.
And so I've just been made aware of it. And so I'll be working with Dr. Michelle Redmond and others to really help shed the light on the oil spill. And so we really want to leverage the center's influence and help not only shed light, but look at providing resources for those that have been impacted. And so they have been able to trace back the spill that happened, or at least they were first made aware of in 1999 to, Black maternal health, because where the spill happened was in a predominantly, lower income African-American area. As liver cancer. So not only do we want to help with screenings, help with education, but that's one thing. But what about the people that have been directly impacted? So I want to see about getting or help with resources, whether that be medical or financial. And so we're going to be working with the neighborhood associations in Wichita, in addition to our health departments. We have a team that it's already starting to come together, but we want to help to kind of synchronize that and be that support that is needed to really make people aware of this spill and help educate and help compensate those that have been affected.
Right. So just for background, because if you're listening to this right now going, what spill? What? So there was a derailment. There was a train derailment. A Union Pacific train carrying chemicals derailed like in 1997, 1993. I mean, it's been a minute. And so the cleanup project, the cleanup has been ongoing and it's nearing the end of its cleanup cycle. But because it's nearing the end of the cleanup cycle, Union Pacific announced that they're nearing the end of their cleanup cycle. And then a lot of people in the community are like, clean up what? What's going on? And then now here we are. And so then I know KDHE did a health study to survey what was going on in the area, and there were some findings that had elevated beyond what would be considered normal of liver disease or liver cancer, liver cancer, I think it was. Yeah.
Liver cancer, and then infant mortality rate.
Right.
Specifically.
Yeah. And I mean, they found a lot of stuff, quite frankly. I've read those reports. And so I'm like, whoo, child. Quite frankly, I have a different view of dry cleaning situations, dry cleaners too, because like they put a lot of crap in the ground as well. That's a whole nother show.
But
let me stay focused. Me stay focused. So that would be was that research?
So that's research. Yep, so that's research. So we are starting, again, a lot of work is happening, but that's going to be one of the main initiatives that we focus on. There'll be many. We want to look at, diabetes and doing a study on that, bringing together, groups to just, and really kind of, impressing upon the community to tell us what other projects we should focus on under the research pillar. But those will be the two that we'll focus on
for now.
For now, and they're going to take some time to do, but we really want to do it well and really. And I hate to use the word excited because you're never excited about something that has negatively impacted people, but I'm glad that we are now made aware of it, and now we can really get the community together and really hopefully make a positive impact. And it's not just being informed, but we are helping improve the outcomes and those that have been affected by this oil spill.
That's awesome. And KU's funding this research. How does I sort of live in this C3 world of like, I'm like, where are you getting your money?
Well, if you don't mind, let me talk about, so no, KU is not necessarily funding it, so the Center of African Health, and we are aligned. We are looking at how we can get additional funding for this project. And so just from a funding perspective, I'm really excited to announce, and again, a lot of this work happened about 2 years ago, but we received $2.14 million from the Kansas Health Foundation, which is fantastic news. In addition to Health Forward has provided us funding for the next 3 years, and the Reach Foundation has given us funding. And so we are so excited to have wonderful partners on board, and they believe in the mission and the vision of the center. I really wanted to set us up for success so that we can start to do the work that we're talking about.
This is just wonderful. This is really wonderful. This is very exciting. And then, so the policy is the last of the pillars.
So the policy, who's been led by Dr. Charlotte Smith, really will focus around Black and maternal health and how we can, not only improve those outcomes specifically around, maternal health. We also want to impress upon our elected officials and how we can make policy our change policy that is innately discriminatory and is systemic by nature. And so I'm working with Dr. Charlotte Smith to really focus on how we can improve and impress upon our lawmakers in Topeka. And so there's a number of different initiatives that we're going to, look at within the policy realm. But my overall goal right now is to just really get in front of, our local commissioners and state to start to educate them on the center and figure out how we can come together to create some synergy and look at some of the policies that I said, negatively impact, men and women, but specifically, I could never say that word, specifically women that are childbearing, are birthing persons that are childbearing age. So, yes.
So okay, so and like we mentioned, Charlotte Smith has been on this my little, I don't even know what to call it. It's not really a show, but she's been on twice, and I know I've done testimony for her maternal health bills as they've tried to make their
Mhm,
way through the Kansas
mhm,
legislature. So I think one question that I feel like I hope it's not a hardball question because I get the question all the time because
mhm,
it's the African American Affairs Commission and yours is the Center of African American Health. And
mhm.
I know, especially in the climate that we're in Kansas, a lot of times anything that specifically says African American have you heard this? Well, why are you only focused on Black people? Why are you not focused on fill in the blank?
Sure.
Right.
Well, first off, so when we say Black and African American, you know that there's a whole diaspora. So there that could be Afro Latinas, that can be, so it's Black and African American health. And here's what I would say. We want to focus, or we're focusing on those that have the highest number of disparities in our community. But it is not to say, and as a matter of fact, we are partnering with HUTOS, who focuses on
Mm-hmm.
the Latina community. So, although this is our area of focus, we recognize that there are other organizations that are focusing on other ethnic groups. We want to partner with them, and so it's not a one and done or an exclusive. We want to be inclusive and partner with other organizations that that are impacted by disparities that exist within
Right.
our community. So, what I say to that, just to kind of you know put a period on it, is yes, we're focused on Black and African Americans, but we recognize that the disparities take or exist in other races and other cultures, and we want to partner with them in addition to our areas of focus.
Yeah. Yeah.
Yeah. Yeah. So
I would take that answer.
well, and here's the thing, the disparities exist and
Mhm.
the disproportionate racism exists. And so there is a need for a center like this.
Mhm.
And I always say, look at the numbers. Look at the numbers. Look at your latest, community health assessment. Look at, the number of, child maternal deaths.
Yeah.
Um, the numbers are there. So a center like this, needs to exist. If the disparities were not there, we wouldn't have to have a need for a center of African American health, but we do. Just like there's HUTOS and there's El Centro, there's other heritage centers that are focused on other groups that have disproportionately been, discriminated against, and so the need is there. But it is not to say that we're not, and we will partner with those other organizations to help make a positive impact across all channels, specifically in Kansas and beyond.
That's great. That's
Mhm.
great. Now we didn't talk much about you, and I remember saying that I was going to go back and sort of say like
Yeah.
when you like because I've only known you in the realm of public
Mhm.
health, but you're like, no,
Mhm.
I don't have a public health background. So like, how did you even wind up at Wyandotte County's public health department?
It's so funny. So I spent about 15 years of my career in sales and marketing. And so I have an MBA and with a concentration in healthcare finance. And so I was in long-term care and, sort of reached a glass ceiling. I became a VP and was traveling everywhere, but was not fulfilled. And, unfortunately, as many, women in leadership can tell you, you know, came across, some, un, discrimination. Quite frankly, I'm just going to call it what it is. And so, for a number of reasons. And so, I decided, I wanted to be led by purpose and passion. Didn't know what I was going to do. Didn't even know about public health. I didn't even know it was a thing. I knew about public health, the term, but didn't know what that looked like. And so I decided to just start doing some consultant work. And I had, done a lot of project management and worked on a lot of projects. Somebody approached me and said, "Hey, this is right before the pandemic happened." Said, "Hey," well, actually, it did happen. And so someone said, "Hey, Wyandotte County is looking for a project manager to help manage their COVID. And I think you would be great." I did not know what I was doing or what I was getting into, Stacy. And I always say public health found me. And so once I got into the role as the COVID project manager and was managing all that, I just fell in love. I fell in love with the work and the purpose of it. And so I haven't looked back since. And so I've been able to marry my business background and sales and marketing background, and building relationships, being strategic, and kind of understanding the big picture, and focusing it and operationalizing it so that programs can exist. And so that is what I'm doing, and why I'm here. And health equity is just something that's important to me. And so now I'm able to do it every day. I was doing it just as a person who was from this community, but now I get to wake up and say, what can we do to positively impact the lives of Black and African Americans, but just people in general.
Yeah.
And so I'm blessed and I'm honored to be in this role. So that's how I got here.
Fantastic. No, I love it. Often, I didn't, when I was like this idea of what was 9-year-old Nicole. Did 9-year-old Nicole think she was gonna, be in public health? Because like 9-year-old Stacy surely didn't think she's gonna be in like politics.
Exactly. I thought I was going to be a singer and either a lawyer, because I talked all the time. My dad said, "You talk too much, so you need to be a lawyer." And I had a decent singing voice, and so that's what I would tell people. But no, the 9-year-old Cole did not think she would be doing this. But man,
I mean, I'm pretty sure I'm on record saying that the 9-year-old Stacy was trying to be a Dallas Cowboy cheerleader. It didn't work out. I
know
I feel
physical fitness is your thing, though. So
I've landed on my feet. I've done okay for myself without being a Dallas Cowboy cheerleader. So So are there any big projects? I know you had the Juneteenth launch, and so I was there, and that was a nice party, and it was wonderful, and did my dancing, and did the wobble and all the things.
Yeah.
Is there anything on the horizon? Any events?
So there's a lot of events that are taking place that we will be partnering with other organizations. So there's a Blackout event that focuses on the LGBTQI community. That event is going to be taking place. Let me get the dates here. We are sponsoring that event. Bear with me. I can give you the date. There's also, why I'm looking for that, there is the Birth Equity Summit and the Kansas City Heartland Conference that is coming up. That's going to be September the 15th through the 16th. I'm sorry, the 14th through the 16th. And so I'll be partnering with Kansas Birth Equity Network. They're putting on a family reunion style event where we really are focusing on uplifting Black families. And so it'll be food, music, DJ. I really want to invite the community out. So that's going to be, again, Saturday, September 16th. And that's going to be from 10:30 until 2. That's going to be at the South Broadland Presbyterian Church at 7850 Holmes Road in Kansas City. But the actual conference itself, the Heartland Conference, will be held at Children's Mercy Park in Wyandotte County, the one sporting KC. So that event will happen as well. And there are a couple of other smaller childbirth equity conferences that we will be attending. Vibrant Health is having their One Vibrant Voice. And so that is an event that the center will partner or attend and sponsor as well. And so a lot of what we're trying to do right now is look at what is happening, around health equity, and how can we partner and leverage support them financially. So not a whole lot of groups at this point, a lot of events that will just be center focused, but we really want to partner with what's already happening. And as we start to just grow and develop as a center, we will certainly have events that will be put on and sponsored by the Center of African American Health.
Fantastic. So I know about the KBEN birth equity. In fact, I'm like, I need to get Charlotte back on ahead of that so she can, do some advertising and talk about it. Yes, this has been really great. As soon as I heard that, like I said, as soon as I heard that the center was even existed, I'm like, I need to learn about it. Then of course I found out that you were the director, and I'm like, okay, this is even better. So I don't have a huge audience, but I'll try to get the word out that you guys even exist and help.
I appreciate it.
Get out there in the world.
I absolutely appreciate it.
Is there anything else you want to say? We got like a minute left. Is there anything else you want to say about the center or about the work or anything else?
just really back to the Blackout Empowerment Summit. That's going to be August the 12th, and that'll be from 11 until 1. And as I mentioned, we have the Heartland Conference and the Kansas Birth Equity Network coming up, and that'll start on September the 15th. And so those that want to find out about that, they can. There is a Heartland Conference. It's heartlandconference.com, so they can sign up and look at the breakout sessions, look at the keynote speakers. But I think I just want to leave. First of all, thank you so much for having me on and allowing me to talk about the center. But just want to, if people are curious and want to learn about the Center of African American Health, we do have a website, and we're building out that website. And so I'll share that website. It's the Center of African American Health, KUMC.edu. And so I encourage people to get on, look at the website. We'll continue to develop that and have lots of resources. And we're just, we're here. This is not just a center that we're looking to open and have and then maybe go away. We want to be here for many, many years. And when I say many, many, for generations. So I'm really excited to be, helping to lead this work, and would like to partner with the community. And we're happy to be here.
Fantastic. All right. Well, thank you so much. Thank you so much for the time to talk to us. And I will put all those links. I took some notes. I'll find out all the details and get it all in the show notes and all it'll be emailed out, the whole nine. And thank you so much, Nicole, for joining me today.
Thank you so much for having me. It's been a pleasure.
Thanks. And bye, everybody. I will see you next Monday.
Yes.